We have also collaborated with the VA and others in an unprecedented ways to ensure that these initiatives effectively and efficiently address the needs of veterans and their loved ones. The Veterans Health Administration anticipates 8.5 million veterans in their system this year, with more than 6 million of them receiving some type of individual care. That number has doubled over the last decade and will continue to rise. According to the recent VA statistics, more than 625,000 Iraq and Afghanistan veterans have sought VA care out of a pool of around 1.25 million. The number of women serving in uniform far exceeds any previous conflict, and they serve in roles that increasingly expose them to the risk of combat, injuries, and death. Approximately 214,000 women serve in the military today, with more entering every year. The VA estimates that more than 40% have already enrolled for health care. They expect that number to nearly double in the next 20 years. The VA must provide more gender-specific primary care for services in all medical facilities. The VA must take the lead on researching the effects of war on women, which includes PTSD and military sexual trauma. More than 42,000 service members have been wounded in action over the last decade. But that number does not include those suffering from invisible psychological wounds. Veterans who suffer from traumatic brain injury and other cognitive impairments are often in difficult situations, since the effects can be both severe and not immediately obvious. The Veterans of Foreign Wars believes that creating a baseline to measure the effects of IED explosions and other concussive events will help to identify and treat those with such injuries.